MANDAGITARI BARIKANWE Ugima irobati gutegerwa na ritho rethaga KENDA kwagirithia utungata bwa kiaria bithaa babaugite gitaru kia East Africa ikibati kumurika Ugima KENDA MANDAGITARI bethirwa na kagita gakauthu ngwene cio.
Public Service International Unions from East African region, from 5 countries, but Public Service International is in 154 countries all over the world with over 700 unions. We have been meeting here as East African unions. This is the second day and the last day. We have been looking at issues affecting the health workers in the region. We have also shared information and experience from the epidemics and pandemics that have been affecting the region. We are asking our governments to increase funding in the public health sector.
Representatives of the East African sector unions are deeply concerned on the deteriorating state of public health care system and public health care provision in East Africa region. The governments in the region must prioritize provision of public health care services. COVID-19 pandemic, Ebola, and the extreme impact of climate change, poor funding of the public health care services have exposed the need of all the governments to invest deeply in the healthcare services. The states in the region are generally struggling to invest a minimum 15% of total annual national budget demanded by the Abuja Declaration in the year 2001, which is averagely 20 years back. The meeting in session identified the pressing challenges faced by the health sectors in the region to include the following: vaccines, vaccine access, hesitancy, pandemic preparedness, and local productions of the vaccine; financing of public health services, and an equal health service provision, health inequity within the region. The meeting in session resolved to engage the governments within East African Bloc to address the identified pressing challenges. Specifically are decline in the level of government investment in the delivery of public health services. And I believe, if the public health service delivery or investment is reduced, then there's more to the private. Number 2, poor and inadequate public health care emergencies and pandemic preparedness. We are all caught off in every pandemic and every outbreak without any preparations. Number 3, poor access to medicines, technology, and vaccines in the Eastern African region. We have identified this to be a problem in all these countries within East Africa. The effect of climate change to public health care system. We need to prioritize that as a region to ensure that we are part of the conversation.
As Public Services International, we noted during the pandemic that many of the governments over the years had actually reduced the level of funding. Now, this led to a number of lives being lost because our public health systems were not able to manage the COVID-19 patients. We saw not only the health workers, the rich guys went, talk about the poor. It was not discriminative. Now, that gave us a number of lessons to learn from. First of all, and it is the same information we want to give to our governments today, even as we try to recover the economy from the wrecks of COVID-19, it is important to invest money in your public health system. Because the quality of any country population, the index is actually measured by the quality of life of your people. And if you're going to ensure the quality of life, then you need to put enough money in public health infrastructure. That is going to be very critical.